The German government says it is preparing for possible attacks on coronavirus vaccination centers, vaccine shipments, or vaccine makers. Now, according to the Interior Ministry, there is a, quote, abstract threat of sabotage on Germany's vaccination campaign. In a letter, the ministry said vaccination opponents and conspiracy theorists could try to break into facilities or launch cyber attacks. Now, German vaccine manufacturers have already been targeted on several occasions by hackers attempting to steal intellectual property. For more on the story, we can bring in our political correspondent, Emmanuel Schaz, here in Berlin. She's following the latest. Hi, Emma. This sounds serious. I mean, how dangerous is the situation?
Well, it is a very serious situation indeed, and German authorities warned against the high risk of, for example, cyber attacks against research sites, production sites, or vaccination centers. They say also that they've identified already some individuals responsible for such hackings, and beyond that, they also worry about the protests that are taking place, organized by coronavirus skepticals, by anti-vaxxers. They fear that those protests could go get out of hand the way they, for example, went out of hand on a political level at the Capitol in the United States. So there's a very serious threat here in Germany that the whole vaccination rollout might be at a risk because of that. But as you mentioned, authorities are also confident that they're on top of things right now.
Okay, so authorities say they're monitoring the situation. Meanwhile, officials here in Berlin have shut down an entire hospital after identifying cases of the new mutation of COVID-19. We'll talk about that in a moment, Emma, but first let's take a look at this report.
The Humboldt Clinic in Berlin, where more than 1,500 staff and 400 patients are in quarantine. The hospital will not be admitting any new patients for at least a fortnight. It's not nice for the patients. They aren't allowed any visitors. I am sad. My daughter is inside. She's waiting for food and drinks, but I can't go in. The closure comes after 14 patients and 6 staff members tested positive for the highly contagious new COVID-19 strain that originated in the UK. Staff who tested negative are in a so-called shuttle quarantine, only allowed to travel between work and home. But testing of all patients and staff is ongoing. The first results are starting to come in, and we are not optimistic. We hope to have a better overview of the situation in the coming hours and days, but we can already see that the number of cases is increasing. The Humboldt Clinic is considered exemplary. It is one of the only clinics in Berlin that has been testing for the mutation since the start of the year. It was only because we did a preliminary screening of positive tests that the new virus strain came to our attention, and we could act accordingly to protect the population, as well as our employees and patients. Despite their quick action, there is great concern that the new virus variant will still spread uncontrollably, both in Berlin and the rest of Germany.
Emma, this hospital has been sealed off, and that means that staff is being shuttled between work and home. But that does still mean that they would be in contact with other people.
There will be, but that just shows you just how difficult it is to prevent essential workers from actually doing their work. This is impossible. We need doctors, we need nurses, so they do have to commute from home to work. But for that, the government also put at their disposal shuttle buses so as to avoid as much as possible that those people come in contact with the general population, for example, in public transports.
And bring us up to date on the overall situation right now in Germany.
Well, authorities are very worried about the new variant of the virus. It is said that virologist Christian Drosten from the Charité Hospital who confirms that it is said that this variant is 35% more contagious, more infectious than the virus that we currently now know. And in Germany, there's been tighter border checks implemented on Sunday. This might mean that there's going to be be some impact on fresh food import in Germany. There's also additional controls implemented in airports on people coming back from high-risk areas. Now, on the situation regarding the virus, there's less infections registered today and less deaths, and also a 7-day incidence rate that is still decreasing. There's 111 cases per 100,000 inhabitants, but that's still 2 times higher than the critical threshold. The vaccination rollout is still ongoing, with 1.5 million people vaccinated at the moment, and also a new medicine will be implemented. This is a new antibody medicine that will be given to patients so as to avoid that they develop severe symptoms from the coronavirus.
Our political correspondent Emmanuel Schaz with the latest here in Berlin. Good to talk to you. Now, the first nationwide curfew in the Netherlands since World War II has sparked widespread rioting. Unrest flared up in the capital, Amsterdam, and the southern city of Eindhoven. At least 30 demonstrators opposing tighter coronavirus restrictions were arrested. Thousands of rule breakers have also been fined.
Anger boils over against the night curfew, the first in 75 years. On the streets of Eindhoven, protesters set a car on fire and then rampaged through shops and the train station. This demonstration in Amsterdam is illegal, but residents are furious at the months-long lockdown and now the new curfew. Live free. Think and think freely. They say their freedom and future are being sacrificed in the fight against the virus.
Ik ben het niet eens met het beleid wat op dit moment gevoerd.
I don't agree with the restrictions on freedom. It's certainly true that elderly people are vulnerable, but there are also so many young people involved, and young people are the future. This is a voice that is saying no. We are so afraid we're going in the wrong direction. It may be understandable, but it's still the wrong way. The government says the curfew is a preventative measure. The number of new positive tests had been falling. But Prime Minister Mark Rutte warned against a possible surge of infections from the British mutation of the virus. Hours after the curfew came into force, this is all that's left of a COVID testing centre on the coast. And in Amsterdam, riot police break up a mostly peaceful demonstration with water cannons. The Netherlands was one of the last EU countries to begin immunising health workers. With production delays slowing vaccination programmes across Europe, a return to freedom here and elsewhere still looks a long way off.
In Brazil, thousands of people have joined a second day of nationwide protests calling for the removal of President Jair Bolsonaro over his handling of the pandemic. The national coronavirus death toll stands at more than 200,000, the second highest in the world. Vaccine shortages are holding back immunizations, and public anger over the worsening situation is growing.
Alice Gomes is desperate. Her mother needs a ventilator, but the ones in the hospital are all taken. Now, doctors aren't giving her much hope. All I want is for my mother to have a chance. Relatives don't get much information. The clinic is totally packed and overburdened. Intensive care beds are full. Oxygen has been in short supply for at least a week. Hundreds of people wait for hours to refill tanks so that their loved ones at home will be able to breathe. The second wave of coronavirus has hit Manaus hard, and the virus has mutated. As many as 200 victims are being buried every day. That's 7 times more than before the pandemic. Doctors say government inaction is to blame. The collapse could have been averted. The more the virus can multiply unchecked, the more likely it is there will be mutations. In Rio de Janeiro, life continues rather carefree. Perhaps because the president downplays the virus and publicly doubts the safety of vaccines. In the meantime, people are getting inoculated. Bolsonaro's political opponents exerted a lot of pressure and made their own deals with manufacturers. People are protesting against Bolsonaro because of the erratic rollout of vaccinations. They say he has to go.
Now to some other developments in the pandemic. Mexican President Andrés Manuel López Obrador says he has tested positive for COVID-19. That announcement comes as his country registers the highest levels of infections and deaths to date. Israel will close its international airport to nearly all flights in a bid to bring a raging outbreak in the country under control. And Egypt has started vaccinating its population using the Chinese-made Sinopharm shot. Healthcare workers and people with chronic diseases are among the first in line to receive the vaccine.